Hi, welcome to Talkin Business. I'm Joe Catrambone, CEO of the Stewart Martin County Chamber of Commerce and host of Talkin Business. And today it's my honor to have another Snyder with me today. Had the sheriff earlier, and so I've got David with me today. David, thank you for coming.
It's great to be here, Joe.
Taking time out of your busy schedule. I know you're busy, and as your dad is, and I've said we were honored to have him as my first guest today. So, obviously, I know your dad, and I've known you, and I know your family history. But one of the things I like to start off with is to let people know how you ended up in Martin County. Now, I know.
Sure.
Now, the one thing I don't know, were you born here?
No,
Or you were
just
born down
missed
south?
it.
Okay.
Yeah, just missed
So I know the story, but how about sharing with our viewers?
I'd be happy to, and thanks again, Joe, for having me here and
my
tolerating
pleasure.
another Snyder in the same day. That says a lot about
I
your
was
character.
hoping John could come too.
Yeah. So our story really started in South Florida. We're Miami transplants, but I'm a Florida native. Came up here in the mid '80s in an effort to try and find a community that was a good place, as I understand it, to raise children. And now, as a father raising children here in Martin County, I have to agree with the decision that was made to move up here. It is a great place, but Martin County is a wonderful community. It's a great place to do business. It's a great place to raise a family, and we're so happy to be here. And really, it's an honor to be here with you today to talk more about it.
Well, we were talking earlier again. I can't keep talking about your dad, but Barb and I were actually involved in his first campaign for sheriff. So we supported him. I liked him from the day I met him, and it's an honor and a pleasure to have your dad and you and your brothers and your sister and your family here in Stewart and in Martin County.
Thank you.
Obviously an asset, and as far as I'm concerned, your dad's a legend.
Well, I sure think so.
He didn't. I don't think he'd like if I said that. But so,
I'll tell you, Joe. One of the things that's so important to me, and really as I reflect now as a business owner in Martin County, and kind of looking at the first 30 years or so in Martin County, and then the 10 years following that in business here. One of the things that I'm struck with the most is that the culture of our community has remained the same. Although, we were talking earlier about the roadways do definitely feel a little different than they were in the 80s and 90s.
you think?
Yeah, just a little bit. But what's so incredible to me, and what I hold very close to me, is the culture of our community and the contributions of so many around us. You said just such a kind thing of you to say. My father, I think the world of him, of course, but he is part of a legacy, really, of law enforcement in our community that goes back to the days of James Holt. And for those that were around during those times, I
That
think
was the Wild West, man.
it was the Wild West.
Get the posse up. Get it.
And I remember that, and
I do
I'll
too.
tell you, as a young kid, when my dad was at the sheriff's office, watching. I mean, they were cowboys. They put cowboy hats on.
They
and
were.
saddled up horses and
Yeah.
went out and looked for
Had
bad
their
guys.
rifles and their
They
slings.
did. They sure did. But that idea that preserving the culture of a community and preserving the safety and the well-being of our residents, in many ways, it's been inspirational, not just to others in the community, but definitely to me and my brother. You look at what my brother's doing, serving the community. And so it's important, I think, for all of us. And that's really the legacy that's worth talking about. The legacy that was left behind was a desire to serve our community and try and be a tool in that utility knife. You don't need every tool every day, but when you need that tool, it's important to have those resources available. So it's an honor for us just to be another tool in the toolbox.
Well, and you certainly are. So, what led you to the healthcare field?
Oh, it's a great question. I'm glad you asked it,
Yeah.
because it's very important to me. When I was a young boy, my mother was a nurse by trade, and she had an opportunity to go out to Indiantown and teach a CNA school. And she was not an educator by trade; she was a nurse by trade. But through that experience, what she saw was an opportunity to enhance and enrich the lives of others in our community who maybe didn't have opportunities that they even knew were available to them. And through that CNA training and through that CNA, the certified nursing assistant, through that training, what she realized was she was an entrepreneur. And I think for everybody, that light bulb goes on at a different time and a different place. But for her, she had 10 graduates at this school, and they didn't know where to go to work. And so she went out, and most stories in home health really start with, it was, grandma or a mother or somebody who needed care, and that inspires people to go into that field. For us, our story's a little more unique and a little different because it really started with a group of ladies who needed jobs and wanted jobs in the healthcare field. They wanted to start that career path. And so for us, it was really workforce development that started it. We had folks with an education and a skill set now that needed work. And my mother put on that entrepreneur's hat, went out and found 10 clients and put these ladies to work. And that was over 30 years ago. And so for me, healthcare was something that was introduced at the kitchen table. This was before the days of regulation like we have today. And you just kind of went out and went to work. Now, obviously, we have evolved over the years, and we are a licensed, accredited, and insured agency. We are an agency licensed through the Agency for Healthcare Administration in Florida. But it was that experience as a young boy, seeing the work that was being done and looking at these caregivers and being so impressed by them. I was really kind of shocked at the idea that you would go into a stranger's home and provide care to them. And for a 10-year-old, that was very intimidating. But as time went on, with most family businesses, you do every job that needs to be done, from answering phones to doing paperwork to scheduling to doing caregiving yourself. And so
that's how you become a CEO.
Certainly
go through the rigors and take the steps.
That's it. And so for me, it was a unique opportunity to get to do that. And so now I'm blessed to be doing legacy work and carrying on the tradition of what our family started in Martin County, which was a home health agency, and very proud to be licensed in 22 counties around the state now and calling this our headquarters.
Wow,
and
22 counties.
Yes. Yeah.
Wow. So how many employees have you got?
We have several hundred caregivers that work with us from all across the state. And it's just so humbling and rewarding to get to hear those stories and hear and
it has
see
to be heart-wrenching.
Yeah. But to see the level of commitment and involvement that our care teams give to our clients, whether it's as caregivers or nursing care, to see the work that's done. And that's really that's what our business is. It's at the bedside with our clients and our patients in their homes.
So your mom was sort of the catalyst for the healthcare.
She was.
What did you go to school for? What's your degree?
My degree is actually in criminal justice. So,
Okay,
again,
that figures.
a slightly a different path, right, for every person. But I was in law enforcement for a number of years. But it was so evident to me that what the family what we had started as a family business really was so important to all of us in the family. And I believe in that mission so much. And so now to be, participating in a family business in our community is truly one of the most rewarding things I've ever done.
I was going to say, but it has to be rewarding.
It really is.
So did you go into the Marine Corps to give you experience to get into law enforcement, or it's an interesting
It is a good question,
dynamic. You go into the Marine Corps and then you come out and go to college. That's an interesting dynamic. So is that why you went into the Marine Corps, to get the background, because you wanted to be in criminal justice?
Yeah, really. I kind of wanted to have that freedom, and I thought that there may be more, maybe a little less strict outside the home of our sheriff. And turns out the Marine Corps really didn't have anything on that environment.
They trained
so it
him.
wasn't quite the liberating experience I was looking for. But I'll tell you this: what I was able to get during that time was an appreciation, not just for our country, but really for our community. And I'll tell you, Joe, this is going back now to, 2003, but you remember after 9/11, the feeling that as a country, the way we felt. And I'll tell you something that I don't share very often, but I'll tell you that when I was deployed to Iraq, I was 20 years old. And you remember we used to have a newspaper that printed out on paper, and they would throw it on somebody's driveway, right?
Yeah, I remember that.
And my family would cut out the articles, and to see the support, the unbelievable, overwhelming support of people in our community lined up on the Roosevelt Bridge from one end to the other, waving American flags in support of the troops, not necessarily in support of a political agenda, but supporting the men and women from our community that were there at the behest of our leadership in our country at that time. And I got to tell you, Joe, it was one of the most impactful things I've ever experienced, and I've never forgotten it. And I still have those the newspaper clippings of our community standing arm in arm together along that Roosevelt Bridge and I'm sure you remember. I'm sure you were probably out there. So for me, I wanted to give back to the community that showed me such tremendous love and support during that time, and so. Everybody has to find their path, and this is the one that found me.
Well, and obviously you're quite successful at it.
Well, thank you.
How was it? And we'll talk more about your healthcare.
Sure.
But I'd like into more personal. What was it like growing up in a community where your dad was sheriff? Now, I had my dad was president of the school board, and my uncle was mayor of my hometown.
Oh, so you know exactly what it's like, yeah.
Yeah, but yeah, I do. But that was the city. I was 10 miles out of New York City. It's a different. This is
right.
So much different. But what was it like? Was it?
Well, I'll tell you this. There were definitely some very important lessons that were learned early on. So I can tell you, when I got my driver's license, I realized that if you go just a little too fast, somebody might write your license plate down. And before you make it to the next stop, there's a good chance your dad might be waiting for you when you get there. So I could tell you, I learned very quickly that I was not afraid of cops as much as I was afraid of Dad. And he just happened to carry.
He happened to be a cop.
Both, yeah. So, yeah. But it was a very eye-opening and enjoyable experience. I remember when I was in middle school volunteering at the sheriff's office, and some of the folks there now that are in leadership at the sheriff's office were young deputies and detectives at the time. In fact, John Budenseek, who's running for sheriff now
he was
here
your
in Martin
neighbor,
County.
wasn't he?
Well, he was a friend of mine from school.
Yeah.
And so I would come home on leave from the Marine Corps, and at the time he was just a slick-sleeved detective. And really, I attribute my love for law enforcement, ironically enough, not to my father, but to John Budenseek.
Really?
And riding around with him and realizing you could have a lot of fun doing this. And so that's kind of what pushed me in that direction. So thanks, John, for that one.
Yeah, and John has done a great job. He's come a long way.
He's
obviously.
amazing. Yeah, really.
Yeah, he's going to make a great sheriff.
He's going to make an incredible sheriff.
It's going to be difficult to fill your dad's shoes, and I'm not saying it can't be done, but it's going to be a tough job. We're so fortunate to have you and your family here, and especially your dad, who obviously paved the way for you guys to be successful and live the lifestyle and the type of.
Well, you said legacy earlier, and legacy is so important, and it's a big thing to live up to. There's a number of people, and I've watched this show on YouTube. I've seen many of the folks that you've interviewed before, and so many of them have that generation just before them where they're doing legacy work. I could spend 10 minutes just rattling off businesses where it's second and third generation, and really what I consider myself in a very lucky group of people where we are continuing the legacies that our families invested into our community, and I think that's encouraging. I think that's a very unique thing about Martin County to have that.
Absolutely, no question. That's a legacy.
It is. That's the legacy.
Yeah, exactly. Right? we're in a changing world. Things change daily, if not hourly. What do you see in your industry? Do you see anything revolutionizing or being an asset or detrimental to your industry?
Yeah, in 2020 we got to experiment with a global pandemic, right? We got to try that out for the first time, and I think during that experience, our population really began to understand the importance of healthcare providers, and so it was really neat to see that. It was almost reminiscent of that 9/11 time. Everybody appreciated law enforcement and first responders,
And they
and
loved their
military,
country.
they loved their
Yeah.
country. And what happened after COVID, or during COVID, really, with the beginning of that, was a renewed appreciation, I think, for healthcare providers, healthcare workers, not just in our communities but around the country. Everything from research and development for cause and effect of what we were experiencing, to the people at the bedside providing that care. One of the things that, particularly in our industry as a private home health agency, that we began to realize was a renewed desire to have care provided at the home, at the bedside, where you feel most comfortable. And not to minimize it, but when you don't feel well, most people just want to be home in bed. And so
Familiar surroundings,
Right.
Yeah, absolutely. Yeah,
Right.
that's so important. So there's an uptick. You think there's an uptick in home health care?
I think that there's a new understanding that care can be provided anywhere that patients are, right? And even looking at some of our large healthcare providers in this particular region, I'm very excited to see that even Cleveland Clinic is acknowledging that care can be done at home. They've introduced care at home. And there's so many different ways to provide care in a home. And I think one of the unique things that we have in Martin County are so many options, right? I think it's easy to look at other providers as competitors, but really what's important, and I think this is important too for consumers or people that are trying to make decisions for the healthcare, making healthcare decisions now for what the future will look like. There are so many options available that what I think is most important is how soon do you start making those preparations. I can tell you every day we receive calls from families that are in a panic. It is an emergency. This was unexpected. There's been a fall. There's been some incident, something that's created a hospitalization scenario, or maybe just a scenario for just more care, right? As diagnoses progress, sometimes they can progress very rapidly and unexpectedly. And so what I would encourage, if anybody listens to this and takes nothing else away, start the preparation as early as you can. It's never too soon to start making decisions on what you want your healthcare network to look like, and we get to pick that many times. And so it's nice to have those options.
Wow. How do people find out about you? Do you get referrals?
We do.
Do
Yeah.
doctors refer?
So in the home health care space, there's really two main deliveries of care that people are familiar with. One is using your insurance, which is oftentimes Medicare or Medicaid, and then there's that private pay option, which essentially steps into the gap and says, insurance isn't giving me as much as I need to remain at home or in my assisted living facility or whatever your home arrangement looks like. And that's where we're able to step in and fill that gap, right? So where your insurance may provide a certain set number of hours, we're able to come in and say, well, we can add additional hours to that and really create an environment at your home with the support that you need to meet the outcomes that you're looking for. And so the way that we get our cases, or the way that people come to us, really is word of mouth. It's referrals from physicians, from the hospitals, from people watching videos like this, just listening to it, saying, gosh, I probably need to make some plans and start thinking about those things.
Okay, so especially me, I mean, I'm at a stage in my life, I am making plans, but that's not one I've made plans for. So
Sure.
how do I do that? Do I have a written document. I have a do not resuscitate, things of that nature. So how do I make those plans? What do I do?
Yeah, no, I think that's good. I think a lot of it starts with those discussions with those closest to you, right? Everybody's family
kids,
dynamics are
right,
different,
yeah,
right?
okay,
You know,
right.
if you have children or you've made those decisions on who's going to make the decisions for you when you cannot,
And
right?
and they know what I want when I'm gone, when I go.
Right. But
know,
until then,
until-
what do you want? Right,
Right.
right. And sometimes that gets missed. You know, I think far too often people just expect that if something happens to me, I'm going to go into the system and they will tell
Take
me
care
what
of me.
is what is
Right.
best. But again, what I said earlier, there are so many options that are available that I think it's really important to sit down and say, well, what is best for me? You know, there are a lot of folks who come to us and they know ahead of time, I am beginning to lose the ability to maintain my independence, right? And that's really what home health care is. It's extending independence. It's prolonging that ability to remain at home and do the things that you're accustomed to doing. And that's where home health can come in and extend that. And then secondly, it's important to say, you know, where's home for me, right? And it's different for everyone. Some folks want to remain in their physical home, that address on the street that they've been in for 40 years. For others,
Which is
right.
that's what my goal is.
Yeah, yeah, and it's achievable. And I think that's the most important thing, is knowing that you can do those things. And so one of the first steps really is reaching out and finding the provider that you're most comfortable with. Interview them, find out if they're willing to come out and talk with you prior to signing anything. And I think that would be step one. And then from there, it's just making the decisions for yourself and ensuring that you have the support system in place that you need to meet your goals.
So typically, tell me the day, a typical day in the life of a healthcare provider going into the home.
Oh, that's good. Yeah. So it can be very different. Again, we provide everything from.
It's custom made, so to
It
speak.
is. It's a
Because
custom.
somebody,
That's
a
right.
diabetic might need a shot. They may need to test their blood. So it's like a schedule that they
Right.
get.
It is a schedule that you get to create. And what's important to remember is that the different needs may be different each day, right? So one day you may need somebody just for companionship, right? I need a couple of things done around the house. I don't feel like doing it. 2 weeks from now, you may need somebody that can help you get up out of your chair and get across the living room to the bedroom. And as you said, as medication, the ability to administer your own medications and manage those medications decreases, we are able to add those modalities and add nursing into there and make sure that we're managing those medications and that the medications are being administered in a timely way. And so, again, it is really so customizable that there is almost, well, I'll just tell you, in 30 years, I've never seen a scenario that we couldn't figure it out. So I think a lot of it is a testament to the healthcare providers and their understanding of what they're doing, but also that communication with the family, with the patients, understanding what outcomes they're looking for. And so sometimes it's just the peace of mind knowing that it's available is all you need to know now, because you just really don't know what you might need.
So many times we hear of, and I've heard of quite often, where a loved one is in the onset of, let's say, Alzheimer's. They're healthy, good, but they're in onset of Alzheimer's or in full-blown Alzheimer's.
Yeah.
Do you provide that? You could provide someone to deal with the Alzheimer's patient?
Absolutely.
So it's not just medical. When I mean medical, it's not just internal medicine. It's
And you bring up a great point, Joe. It's not so much about what is the diagnosis, right? I mean, that's certainly a piece of it, right? It's addressing what the diagnosis is. But what I think is really important, and anybody that watches this, I think it's important. You really do need to shop around and see what your options are. But there's a few questions I would be asking. One is, what do you do about social compatibility, right? Because social compatibility is incredibly important. What training do your caregivers have that address something specific like Alzheimer's or dementia, and dealing with that diagnosis specifically, right? We could spend a whole nother episode talking about different diagnoses
Sure, of course.
and how to address those. But it is absolutely not just singularly focused on what the diagnosis is. It is a social compatibility that's incredibly important. And then having that nursing oversight and supervision, having nurses in the home that are routinely coming in to determine what the outcomes of care are, and ensuring that we're on track for those, is critically important. It's very important.
Yeah, and I mean, it's no secret. People are living longer.
That's right.
There's more people with dementia and Alzheimer's, and I mean, I think. Are you preparing more to deal with that as our society lives longer, or is there anyone concentrating just on Alzheimer or dementia care?
Yeah, there's a number of organizations. One in particular that we support and we're strong believers in is the Alzheimer's Foundation.
They're a great organization.
They are an amazing organization. They have and just for anybody watching, like in the fall, they usually have the Alzheimer's Walk. I would encourage anybody that can to participate in that. I think there are some positive things that are being done in that space. But you're right, people are living longer, and I think the expectations of maintaining independence is going to be so much more important as certainly as my generation begins
That's
to.
my concern.
But
certainly.
even currently, we have people that they don't want to change their standard of living. I mean, life should go on as is, right?
Yeah.
So how do I continue
Yeah.
that? And so our goal is to come alongside as a partner and really
Make it happen.
make that happen, because that we believe that, right? Maintain your activity levels, continue to be a contributing, member to your community, whether it's your neighborhood or your church or your chamber, whatever it is. Continue to do those things, because as a community, we benefit from that, from having that involvement.
Yeah, absolutely. We're winding down. We miss
I
anything
feel
you
it.
want to talk about?
I do. Yes, you have. You have missed something I want to say.
Okay, please.
Joe, I want you to know that for quite some time, I had people pushing and prodding with thumbtacks in my back. Go to Martin County leadership. Go to Martin County Chamber leadership. And I would be doing such a disservice not to just quickly give a plug to Cindy LeConte and the entire team that works on that leadership. And I was able to be there for the graduation last week, and to see that group go through that class. And I know that you were so instrumental in making that really a cornerstone of what the chamber does. And I'm so thankful that we have that here in this community, and that I had a chance to participate in that.
Thank you so much.
So if anybody doesn't know what leadership is, I'm sure you can tell them what the website is, but you really got to go
I've had
look at
Cindy
that.
on. I've had Cindy on.
I saw it. Yeah, I know. I've watched that one.
Yeah.
I'll tell you this. I thought I knew Martin County. My only memories in life are here in this community. And it wasn't until I went through leadership that I began to appreciate the work of our Martin County government, right? The folks that are keeping our parks looking the way they do, all the work that's being done in the medians and the right-of-ways. Those things don't just happen on their own. Those are the results of people who want our community to look a certain way and have a certain feel and be a welcoming environment for those who are trying to open a business here, or raise a family here. And I think that the work the chamber does is so important to that. And whether it's a Stuart Martin chamber or some of the other chambers in our community,
They're all
that
good.
work
All our chambers
is
are good. They do good
so
work.
important. And I thank you all for it.
Thank you for mentioning that, because I always say, and I'll never stop saying it, the thing I am most proud of, and I hope that's my legacy, is bringing leadership Martin County to Martin
legacy,
County.
It's legacy,
And,
brother.
I can't say enough about it, and I've been so blessed with having people like Nancy Saylor and Cindy to carry on that tradition and legacy. So, but thank you for that. I appreciate it, my brother.
Joe,
Thanks.
You got it.
We good?